Hi everybody, welcome to this presentation for Allergies and Anaphylaxis Emergency Plan. Hopefully this presentation will prepare you in the event of an anaphylactic emergency to safely administer an EpiPen. Please remember to click onto the audio icon on each slide for a verbal narration. Thank you. So allergies can range from mild to quite severe. They can escalate rapidly to anaphylaxis. Even if you've had a mild incident in the past, the next time you're exposed to the allergen, it can become a severe allergy or present itself as full-blown anaphylaxis. You just never know. And in the United States, anaphylaxis kills about 6,000 Americans a year. This could easily be prevented with a rapid response and with an injection of an epinephrine pen like the one we're going to get a demonstration on today. Anaphylaxis is a severe, potentially life-threatening allergic reaction that can take seconds or minutes with exposure to an allergen to occur. This causes your immune system to release a flood of chemicals that can cause the blood pressure to drop suddenly, airways to narrow, and block your breathing. Symptoms include a rapid, weak pulse, a skin rash, nausea, vomiting. Their throat may feel itchy, their lips may swell, their tongue may swell, coughing, shortness of breath. Common triggers include certain foods, some medications, insect bites, latex exposure. Anaphylaxis requires an injection of epinephrine. If outside of the medical setting, it also requires a follow-up trip to the ER. If you don't have epinephrine, you need to go to the emergency room immediately. If anaphylaxis is not treated right away, it can be fatal. Some of the more complex pathophysiology includes the rapidness and the immediate hypersensitivity action that happens when you're exposed to the allergen. This can be generalized or systemic or localized, which is cutaneous. And when this starts to progress, it can include contraction of the bronchial smooth muscle, laryngeal edema or vascular collapse, and decreased blood pressure that can lead to shock or even death. So, the objectives of this presentation include to identify the signs and symptoms of an allergic reaction, know how to respond to it, and know how to safely administer an EpiPen. Also, to manage a recovering patient while awaiting EMS. So here is a patient with severe anaphylactic symptoms. Her eye is swollen, her lips are swollen, it's coming onto her nasal passages. You can see the external of her nostrils are slightly swollen, red, flared. Even her jawline is swelling, indicating some throat involvement. If she were to show her tongue, I would bet that's swollen as well. So not everybody presents this way, but it can rapidly escalate to this. If they become dizzy, or they suddenly feel weak, or they may have stomach cramps, itching all over, or they may just have a feeling of apprehension. And they may come to you and say, hey, listen, I feel like I did the last time I had a peanut, or whatever. And they may recognize the feeling before they have any external symptoms at all. So as I indicated before, sometimes it's not so obvious. They may have a little cough, or just a little itching in their throat, or they just may feel uneasy or anxious. That may happen just prior to a rapid cascade of more severe symptoms. When faced with an anaphylaxis situation, it's so normal to be afraid yourself. You're going to feel your own epinephrine coursing through your veins. It's a scary situation and you have to respond fast. So if you think to yourself, I recognize I'm shaking, my heart's beating fast, it's because you're afraid. You may even be in a little bit of denial of how serious the situation is, apprehensive and a little confused. All of that is very normal, even for medical health professionals who've been doing it for years. So the thing to do is to take a deep breath and purpose yourself to remain calm and determined. Just think one step at a time and try to be methodical. You can do it. So now it's time to give the EpiPen. First thing you want to do is have someone call 911 if you're not already in a hospital setting. Remove the EpiPen from the package and make sure that you put your fist around the EpiPen, removing the blue safety cap with the other hand. Remember, blue to the sky, orange to the thigh. Holding the EpiPen with the tip pointing towards the middle part of the outer thigh at a 90-degree angle. Do not worry about removing clothing. Simply press the tip hard into the outer thigh until you hear a click. Keep pressing the EpiPen firmly against the thigh for a full 10 seconds, counting out loud. Remove the needle from the injection site and massage the injection site for 5 to 10 seconds. Monitor the status until help arrives. Keeping the next dose ready as needed. If the patient has received the correct dose of the medication, the needle tip will be fully extended in the window. If not, repeat the injection process. If the symptoms continue and 911 has not arrived, give the second dose in about 15 minutes.
Hi everybody, my name's Melissa King and I'm a registered nurse. I'm here today to give you an EpiPen demonstration. So if you have a student, a patient, a sports player, a friend, or even a family member who has a history of having anaphylaxis or a severe allergic response, most likely they would have been given a prescription for EpiPen. And with that prescription comes this box, and it has a twin pack. There's two EpiPens in there, and they're housed in this sturdy plastic case, travel case here. So I wanted to show you the box because if you're responsible for administering EpiPen, I want you to always take a quick glance at the bottom and make sure that it hasn't expired. A lot of people tend to keep old ones around. Not to say that it wouldn't work, but it's best if it's not expired. And if you have a choice between two, you want to choose the most recent one. So this box here is yellow because it's an adult dosage. There's another box, it is light green, and it's an EpiPen Junior for children under 55 pounds. So hopefully they would have been prescribed the proper dosage and they have it handy. So you have a patient who has symptoms of anaphylaxis. They may have very subtle symptoms, like they're feeling apprehensive, or they'll just tell you, hey, I feel like I did the last time I ate a peanut, or whatever they're allergic to. They just don't feel right. Or they might develop a rash or become nauseous and or have vomiting, or they may even have swelling in their throat that causes them to have shortness of breath, coughing, itchiness in their throat. They feel like their lips are swelling. Often people think those symptoms are later in the game and that's only with severe, but sometimes it happens very rapidly, and every situation is unique. So if you have a student, sports participant, friend, whatever, that has a history of having anaphylaxis, always try to keep that in the back of your mind. So anyway, for the purpose of this demonstration, we're going to use a trainer. That's this, and I'm going to show you how to give it. But first I want to go over a couple things about the EpiPen itself. you'll see it has a blue top to it. That blue top needs to come off prior to administering the medication. And it has an orange tip to it. And this tip here will actually go flush against the thigh. Now, when you administer the medicine, you could administer it right through their pants. There's really no time for taking any clothing off anyway, but I'm pretty sure you have a memory of getting a shot maybe yourself, where they take an alcohol pad and clean the area, or with some sort of antiseptic. Usually it's alcohol, and that's to make sure no infection, no bacteria enter into the body. However, in an emergency like this, there's really no time for anything like that. The main thing is to get the epinephrine in their body and reverse the anaphylaxis, which could kill them. So time is of the essence. So what we're going to do is, once you get the EpiPen out of the case, you're going to hold it straight up and down like this. You're going to grip the EpiPen with your fist. You're going to remove the blue top. Now remember, blue to the sky, orange to the thigh. So you're going to remove the top. Now you're ready to administer it. I'm going to give you a demonstration. So the landmarks you're going to have is going to be the top of your hip bone, or your patient's hip bone, and their knee. So if you're going to go directly in between the hip and the knee on the lateral aspect of their thigh, and you're going to inject right away. Hear that click? You'll hear that in real life. And you're going to hold it there for 10 seconds. At the end of 10 seconds, you're going to remove it right out of the thigh, straight out, and set it aside. And then you're going to rub the area for another 10 seconds. After which, you're going to lie them down and watch them recover for 10 minutes. Now, during this time, someone is calling 911. And so hopefully they're there already, but they might not be. So you want to monitor their breathing, or for any more symptoms of anaphylaxis, any signs at all. Then after 10 minutes, it's safe to administer another injection of the EpiPen. And that's why they give you a twin pack, because this medication only reverses the symptoms of anaphylaxis for about 10 or 15 minutes, after which the whole cascade of events can start all over again. Why? Because you haven't removed the allergen out of their system. That allergen is still coursing through their body and being circulated. So it's likely that they could continue to have an allergic response. So you want to administer the second dosage after 10 to 15 minutes if their symptoms reappear. Well, one thing I haven't mentioned is you. And while you're giving the shot, and while you're monitoring them and responding as quick as you can, you need to relax as much as you can. I know it's hard because it's a scary event and it happens so fast, and 9 times out of the 10, it's the last thing you're expecting. So it hits you out of the blue and you're expected to respond. But the best thing you can do is to take a deep breath and stay focused. It's very important that you stay focused and determined to be methodical, because you can save a life. They're counting on you to be calm, and you can do it. If you have any questions, or if you'd like me to go over it with you in person, please contact me. I hope this presentation was helpful, and I hope that you have a wonderful day. Thank you.
Okay, so there's a few things to keep in mind with handling the EpiPen. You always want to keep it at room temperature and in that plastic tube that it comes in. You do not refrigerate it, and that means do not put it in an iced cooler if you're outside. Do not place it or leave it in a hot vehicle outside in the sun. Keep it in a secure but unlocked and as easily accessible place. Make sure you view the color through the window too. It should be clear. If it's dark or brown, it's time for a new one. And remember, the effects wear off after 10 to 20 minutes. So make sure you call 911 immediately upon using an EpiPen. So while you're waiting for backup to arrive, make sure you monitor the breathing and be prepared to deliver the second EpiPen dose if the symptoms return. Keep your patient in a side-lying position, upright if possible, and reassure them while you maintain their airway. Be prepared to give CPR if necessary. So looking forward, the main thing is to be prepared. And if possible, always know your patients, your students, your family members, if they have allergies, what those allergies are and what their emergency plan is. Always follow the specific ordered medication emergency plan for your patient, and remember, they may vary on when to administer the medication. So when in doubt, give the EpiPen. Don't wait. Anytime an EpiPen is used, remember to please save it to give to the emergency medical personnel upon their arrival. Thanks everybody for viewing my presentation. I hope you've learned something today. I hope you'll remember the important points to be prepared, to review anaphylactic procedures regularly, and if you do have to respond to an emergency such as this, always take a quick second for a self-reflection. Take your deep breath, remain calm and determined. You can do it. Thank you.